X-rays and chiropractic have a lot in common. The discovery of X-rays and the first chiropractic adjustment back in 1895. Over the years, we've learned more about this helpful tool called X-ray and the benefits of chiropractic. The value of X-ray is immeasurable, as it provides your doctor with an inside look at the structures of the body in a way impossible before. Naturally, chiropractors use this valuable procedure in the study of vertebral subluxations. I'm Dr. Earhart, and in the next 15 minutes, I'll be showing you X-rays that will help you to better understand your own case, your doctor's report of findings, and your duration of care. But before we do that, let's quickly review what you've learned in Class 1.
Good afternoon, Dr. Earhart.
Good afternoon. Before we continue, would you please play back the Class 1 matrix for a quick review? I don't know about you, but that's a little fast for me. As you remember in Class 1, health is wholeness, time, and 100% function. By interfering with the nervous system that controls function, the result is malfunction, abnormal behavior, and an early death. So the key to improved health is improved function. We've also learned that the brain is protected by the skull, and the spinal cord is protected by 24 movable vertebrae, and that a misalignment of these vertebrae interferes with nerve function. This misalignment is called vertebral subluxation. It is the most common kind of interference to the nervous system and exists in epidemic proportions in our society. To better understand vertebral subluxation, let's examine a normal spine. From the back, the spine appears fairly straight. Proper alignment helps give balanced support, so there is no pressure on spinal nerves and therefore no vertebral subluxations. From the side, 4 natural curves help support the weight of the upper body and head and cushion the effects of our day-to-day activities. This is the neck area, the shoulder, and the lower back area. We'll be looking at a lot of X-rays today, so first let me show you what these normal drawings would look like as X-rays. First from the back. Before we start, it's important to realize that X-rays are a little busy because you're looking at the whole thickness of the body, not just the spine itself. As in the drawing, this spine is in relatively good alignment. Up close, you can see the spinous processes on the back of each vertebra. As you know, the spinous processes make those bumps you feel up and down your back. The side view can show us a lot too. Up close in the neck area, you can see even more detail. Here's the side view of the spinous process. Here's the disc space, which is located between each vertebra. As you know, the disc is a shock absorber for the spine. This small opening, called the foramen, is where the nerve bundle exits from between the vertebra and goes to the appropriate organ or tissue. As you can see, this small opening, packed with nerves, can become tight and narrow should a vertebra get out of alignment. Lower in the back, where the vertebrae are larger, you can see how the joints on both the top and bottom surfaces are flat and smooth. Also notice the normal disc spaces here and here are large and healthy, and where they attach to the vertebra, the outlines are smooth and regular. As you can see, there are no disc spaces between the top 2 vertebrae of the spine. Consequently, this is the area of the spine that moves most freely and is most susceptible to the insult of injury, especially at birth. When the spine's in proper alignment, you have your best opportunity of being free of this major interference to the nervous system and expressing more of your inborn potential. But when your spine suffers a vertebral subluxation, you can't be the whole person you were meant to be. Misalign a vertebra. from trauma, stress, overexertion, or hundreds of other causes. And in a matter of minutes, you've significantly destroyed nerve function. Dr. Chung-Ha Su, a specialist in spinal biomechanics at the University of Colorado, has demonstrated what interference like vertebral subluxation does. His research team discovered that a very small pressure on a spinal nerve root as it emerges from the spine will destroy 60% of the function of that nerve in just a matter of seconds. And that's just the beginning. Neurophysiologist Dr. Marvin Lutches reports the occurrence of poisons and other toxins that are released within a few hours when spinal root fibers are ruptured at the site of a vertebral subluxation, affecting all the nerves in the area. Could I have the subluxation close-up matrix, please? Here's a subluxation in the neck area. Notice how the middle vertebra is out of alignment with the others. From the back, we see another subluxation. This time, notice how the spinous process of the middle vertebra, which should be centered left to right, has rotated, putting pressure on the spinal nerve root. Ignore those subluxated vertebrae, the soft tissue and bone decay, and the reduced function. Ignore those rupturing nerve fibers and the resulting ill health, and you have the relentless process of subluxation degeneration. Here's a normal spine. It's what your spine could look like if you didn't have any vertebral subluxations. Clinical research has shown that subluxation degeneration begins with the first subluxation and intensifies throughout a lifetime in a series of 4 phases. First, phase 1, occurring between birth and age 20, looks like this, characterized by misalignment of the vertebra and an alteration of the normal curve. And though the disc and bone tissue have not grossly degenerated as yet, there are still poisons and other reduced nerve activity. Phase 1 looks like this on an X-ray. Phase 1 sets the stage for phase 2. As the subluxation degeneration begins, phase 2 is usually experienced between the ages of 20 and 40. Now the disc spaces between the vertebra are starting to narrow. Up close, you can see the ragged edges of the joint that was smooth, and early abnormal deposits of calcium can be seen in and about the joint. If vertebral subluxations are not corrected, you move into phase 3 between the ages of 40 and 65 years in the average person. Now tissue decay and calcium deposition increase. As you can see, the ragged, irregular joint surfaces are starting to grow together as degeneration intensifies. The X-ray shows the beginnings of fusion even better. At this stage, a patient with phase 3 of subluxation degeneration is experiencing reduced mobility and increasing ill health. If left uncorrected, the final act of subluxation degeneration unfolds. Phase 4. Now many of the vertebrae have lost their identity and function and have fused together. These massive, irregular blocks of calcium and destroyed nerve roots have created a terminal condition, generally by age 65, resulting in a permanent lack of health and an untimely death. Is there any hope? Of course, if vertebral subluxations are corrected early enough. Let's quickly review subluxation degeneration.
The work of medical scientist Dr. Hadley has demonstrated that the epidemic of subluxation degeneration begins with the first vertebral subluxation, which usually occurs at birth, and progresses throughout a lifetime in a series of 4 relentless phases. Nerve interference occurs at the site of the subluxation, where the nerve emerges from between the vertebrae. Poison production begins. Left uncorrected, phase 2 begins. Vertebral subluxations increase. Bone and soft tissue decay is revealed in the form of bone spurs, degenerated discs, rough, irregular joints, and severely damaged nerves. Decay increases in severity as vertebrae begin fusing together. permanent vertebral subluxation and nerve system failure is evident. Vertebrae permanently locked out of position, serious permanent bone fusions, totally degenerated discs, destroyed nerve roots, permanent vertebral subluxations, permanent malfunction, terminal condition, cannot be corrected. Phase 4, permanent lack of health, untimely death.
And now you're about to see the clinical value of X-ray research as we analyze the relationship between ages, subluxation degeneration phases, and corrective time.
Phase 4 usually occurs after age 65. Objectives of care: correction of subluxation process not possible. Recommendations for care: intensive care for remaining lifetime. Maintenance care not possible. Phase 3 between ages 40 to 65. Objective of care: to slow or stop the subluxation process. Following intensive care, reconstructive care lasts 2.5 to 3.5 years. Phase 2 between ages 20 to 40. Objective of care: to stop or prevent the subluxation process. Following intensive care, reconstructive care lasts 1.5 to 2.5 years. Phase 1 from birth to 20 years. Objective of care: to reverse the subluxation process to normal. Recommendations for care: following intensive care, reconstructive care lasts 6 months to 1.5 years. This patient has been under care since birth. There is no decay detected. With continued lifetime maintenance care, these patients have the best opportunity to develop their total potential.
Since subluxation degeneration begins with the occurrence of a vertebral subluxation, when do you think is the best time to begin chiropractic care? Since your first subluxation was probably received when you were born, it's important to have children under care from birth, not just for the treatment of disease, but to prevent the silent tragedy of subluxation degeneration and allow them to realize their full potential. Chiropractic offers 3 types of care. It's your responsibility to decide which type best suits your needs. Whatever your decision, your chiropractor is here to help you. First, with initial intensive care to correct vertebral subluxations so the body can begin its natural healing process. Initial visits are frequent and may continue over a period of weeks or months. The second kind of care is reconstructive care. Visits are less frequent over this period of months or years. Care at this stage allows the body time to repair spinal structures and function. Then there's maintenance care. Visits are less frequent and vertebral subluxations are corrected on an individual basis to maintain optimum function. As you can see, your chiropractic examination can tell a lot about you. It reveals what phase your spine is in and what your prospects for recovery are with regular chiropractic care. So as you participate in the review of the results of your spinal examination, you're taking the first exciting step to better health, a better you, and a better world.